welcome you back to In Focus. Maternal mortality is taking a toll on women in the Democratic Republic of Congo. Khalil Gueye reports from Kaziba on a new way of making motherhood more safe.
Several years of armed conflict and social instability, compounded by a poor access to emergency obstetric care, keep the Democratic Republic of Congo among one of the worst countries in the world for a pregnant woman.
Every hour of every day in the DRC, 4 women die from the complications of pregnancy and labor. That is very important because for every woman who dies, 30 have serious pregnancy complications with traumatic consequences such as obstetric fistula.
In the areas most affected by armed conflict, like the eastern province of South Kivu, the maternal mortality rate is high and complicated by unassisted childbirth and poor reproductive health education. Here in Kaziba, 37 miles from the city of Bukavu, people live in the mountains, in villages with extremely poor maternal health care. Pregnant women can spend days walking on rough paths to reach the hospital for care.
We have launched a national gender-based policy on the fight against maternal mortality, and we are also developing knowledge and prevention using door-to-door strategies to disclose the information to women. What kills more is the lack of information and the lack of access to equipped healthcare facilities.
That is why the Kaziba hospital has adopted a strategy to reduce maternal mortality. When they reach their 7th month of pregnancy, women go down to the maternity waiting homes or binyola and wait there until they deliver their babies. Vumilia Luaboshi comes from the mountain village of Musheni.
I came down here to be able to benefit from the good services of the hospital because up in my village there is no ambulance.
But Vumilia has some concerns.
The problem is that we do not have enough room here, and when we finally deliver our babies, we must face the costs.
Better care comes at a price. Many of the women who use this facility will have to cover costs they cannot afford. But the hospital also has problems.
We have a problem when it comes to food management for the patients. The women must find their own food. Some of them flee from the hospital and go to look for a job in the neighborhood.
Despite the challenges, the maternity waiting homes are making childbirth safer for women.
Maternal mortality has drastically decreased here in the Kaziba area. Compared to the past years, we have recorded only 2 cases of maternal deaths compared to the 10 cases or more per year over the past years. Also, baby deaths have decreased 0.41 per year. These results are the direct consequences of the maternity waiting home.
Khalil Gueye, for VOA News, Kaziba, South Kivu.